Just point out, if I might, that we are 29 days into a Democrat shutdown. And the senator from New Mexico was absolutely right. SNAP recipients shouldn't go without food. People should be getting paid in this country. And we've tried to do that 13 times. And you voted no 13 times. This isn't a political game. These are real people's lives that we're talking about. And you all just figured out, 29 days in, that, oh, there might be some consequences. There are people who are running out of money. Yeah, we're 29 days in. And they've done their best to make sure that a lot of these programs are funded. But at some point, the government runs out of money. 13 times, people over here voted to fund SNAP. 13 times they voted to fund WIC. My aching back. Finally realized this thing has consequences. Well, you know what? What Democrats are doing here. They're making plans to keep the shutdown going. And they realize, all of a sudden, 29 days in, that this is a real consequence.
Boy, oh boy, oh boy, oh boy, oh boy. So once again, we got to talk about Democrats getting absolutely grilled, destroyed in interviews with the mainstream liberal media over the simple fact that they refuse to agree with Republicans to open back up the government. Over a dozen times, the Republican Senate has put a bill on the floor, a continuing resolution, a clean continuing resolution to open back up the government. And Democrats have said, nah, we hate Trump so much that we want planes to crash, that we want our constituents to go hungry because they're going to lose their welfare benefits, right? Their SNAP benefits, because we are trying to save ourselves. We're trying to save our jobs because the far left, they smell blood in the water and they're going after the leadership in the Democrat Party. They think that the leadership is weak, okay? So they want to make the shutdown about healthcare, right? They want to make it about Obamacare. And honestly, I love the fact that they want to make it about Obamacare because I get to talk about why Obamacare and socialized medicine is a scam. Okay, and it's just funny because they're trying to turn this back around on Republicans, partially thanks to people like Marjorie Taylor Greene, who at this point, I'm not gonna lie to you guys, she seems like a turncoat, okay, because she is going along with these stupid talking points from Democrats talking about how Republicans need a plan to repeal and replace Obamacare. Now, again, we're gonna talk about that, okay, because the problem is the fact that the government is in the business of healthcare in the first place, okay? Again, we're going to talk about it, but I want to go ahead and play a clip of CNN confronting Senator John Kennedy on the Republican plan for Obamacare. Take a look.
Marjorie Taylor Greene put this up on the X platform this week. She said, quote, apparently I have to go into a SCIF, that of course a place where you read classified information, to find out the Republican health care plan, implying that there isn't one. And she's been pretty vocal complaining about this generally. What do you say to her?
Well, I think the Congresswoman, first, she's entitled to her opinion. I think she was upset because the speaker in a Republican House member conference call didn't talk about what he wanted to do. And I understand why he didn't, because it would the House is like the Senate. It leaks like the Titanic. I mean, it would have leaked immediately. I get that. I think a lot of people, I've certainly been thinking about what we could do to try to fix the Affordable Care Act. There are a number of ideas being batted around. Association health plans, bringing back high-risk pools, which have been outlawed under the Affordable Care Act. I think a lot of young people who are very healthy in between jobs would like to buy a high deductible health insurance that's not necessarily long term. Now, a lot of the insurance companies are not going to like some of these ideas because they're fat and happy and they're making money. In fact, the American taxpayer, the federal government, is sending subsidy checks directly to the insurance companies. That's also one of the things we ought to change. I have no doubt that we can come up with something, Casey. But once again, the longer we go, the egos get involved, and people get prideful. And you saw it with Senator Thune, and probably now Senator Schumer's going to feel like he's got to bite him back, and we're kind of like kids now in the back of a minivan fighting, and it's not a good look. But I've seen it before, and you have too.
Senator John Kennedy with an honest, if slightly depressing assessment.
This is why the aliens lock their doors when they fly past Earth. Okay, nobody's impressed with this, but it's not going to get better until everybody puts their egos aside.
Yeah, so you see that, you heard that. Now, I think that the point that John Kennedy is bringing up is very important because it kind of drives the point of this video, which is that I want people to understand that the problem with healthcare is the fact that the government, the physicians, the insurance companies, big pharma, everybody involved, they're all in on the scam. The scam is to absorb as much taxpayer dollars as possible, okay, from working people and to put it into their pockets, okay? And they do this with regulations. They do this with mandating that the government pay for healthcare for people who don't contribute to the system. And once you see this, you really can't unsee it, okay? I'm gonna give you guys a couple examples of what I'm talking about because the Republican plan, the Republican answer on the issue of healthcare, okay, and Obamacare should be to completely repeal and replace Obamacare with the free market and competition. And some people may say, well, you can't do that. The free market doesn't work in healthcare. That is a lie. Okay, that is a lie that socialists, communists, and the government and Democrats want you to believe so that they scare you into accepting this idea that we have to have the government pay for all of our health care, and that's the only solution, okay? And you know who gets rich off a system like that? Again, big pharma, the doctors, the insurance companies, and the politicians, okay? Let me explain exactly what I'm talking about, right? One of the reasons why we have a supply shortage of doctors in this country is because of the fact that the American Medical Association lobbied the politicians in the late 1990s to cap Medicare funding of residency spots, right? So Medicare actually funds residency, right? So it funds the training schools for doctors. This effectively limits the supply. Now, why would the American Medical Association, aka doctors, want to limit the supply of doctors that are practicing every single year, right? New doctors. Well, because a limited supply keeps the salaries and incomes of these doctors, especially specialty doctors, high. Now, it didn't always used to be this way, okay? Because back in the day, and I'm talking about way back in the day, I'm talking about the late 1800s and the early 1900s, before the government was involved with healthcare, healthcare actually used to be affordable. There's actually a great video on this because once you get red pill on the issue of socialized medicine, you can never go back. But back in the day, people used to pool their money together, right? Regular, normal working people pool their money together into what they call lodges. And these lodges would go to the doctors directly. And they would say, hey, we have a pool of people and we're going to pay you a set salary to see us and to treat us. This effectively kept the cost low because doctors had to compete for the contracts, for the ability to serve these groups of people, right? Now, who didn't like this? Doctors didn't like it. Why didn't they like it? Because it kept costs low. They had to compete. It was on them to provide high quality service at the lowest cost possible because that's the only way that they got paid. So they ended up blacklisting and shaming doctors who would take these contracts with these lodges because, again, it kept the price low, okay? The working class people actually were not paying that much for their health care, okay? And doctors were not being paid an absorbent amount of money, okay? And again, the doctors didn't like that. So they not only shamed the doctors that would take these contracts, but they also lobbied the government for more regulations that effectively made it impossible for these lodges to continue to operate financially, okay? And that essentially gave rise to the modern system that we have right now when you talk about government and private insurance that effectively, again, was not necessary back in the day when you had a system built on self-reliance, built on workers coming together and making doctors compete for the opportunity to serve the workers, right? This competition kept prices low. It kept prices low. And to this day, again, you have all of these big industries in healthcare that are effectively lobbying the government to take taxpayer dollars and to limit competition so that they continue to charge more. I'm gonna give you another example, right? The Affordable Care Act, which again, did not make healthcare more affordable. It actually banned the expansion of most physician-owned hospitals that participate in Medicare/Medicaid. Now, why did they do this? Okay, because the American Hospital Association, aka Big Hospital, they did not want doctors opening up competing facilities. So basically, a doctor cannot open up a hospital that participates in Medicare/Medicaid. Now, technically, a doctor can open up a hospital, right? They can, but they just can't take Medicare/Medicaid, which means that they're losing a large amount of government funding for opening up more hospitals that can compete with other hospitals that are currently operating. So again, the government is artificially suppressing the supply of healthcare, okay, of doctors, of hospitals, and they're also rigging the market with regulations and ways that make it impossible for people to come together as lodges and groups like they used to in order to make doctors compete for contracts to be able to serve people, right? And because of that, because of these regulations, it is much deeper than what I'm getting into this video. Like it's very complicated stuff, but I'm just trying to tell you guys, explain to you guys how the government is the actual problem, okay? And that the free market and competition can work. It used to work before the government got involved. The government is what has distorted the market to the point where healthcare is continuously becoming more and more and more unaffordable. But these idiots, these clowns, these socialists, right, believe that, oh no, we just need more, we need more government, right? And it's like, no, the government is the problem because they're in on the scam. The politicians are in on the scam. The insurance companies are in on the scam. The doctors are in on the scam. The hospitals are in on the scam. The pharmaceutical companies are in on the scam. Everybody's in on the scam. But all that is to say that Republicans, when asked about their healthcare plan, they need to grow a freaking backbone and to tell the truth about how Obamacare is making healthcare unaffordable. Okay? And the reason why is because the game has been rigged in favor of all of the power players that have all come together as a group to suck as much taxpayer money out of working people's pockets as possible in order for them to get rich. This is not capitalism. Capitalism can work in healthcare, but this is not capitalism. And Republicans need to grow a spine and tell the truth to the American people that Obamacare needs to be completely and totally repealed. Okay, we need less regulation. We need these lobbyists, okay, to be rejected in their attempts to continue to artificially limit the supply of medical professionals in this industry, because that is what's inflating costs. It is a giant scam. It's a huge scam. And again, once you see it, you can't unsee it. But again, I can get a lot deeper into it. I just don't have time to in this video. So I have to do it in bits and pieces. So without further ado, let's react to Peter Welch, who's a Democrat senator from Vermont. He is going to be sweating bullets as these hoes confront him over the fact that Democrats once again are rejecting opening back up the government.
Obligation piece, because the other component part of this is, you have this bill now to try to keep SNAP benefits going. Ted Cruz has a bill now that he wants to pursue around, keeping TSA folks employed and on the job and getting their paychecks. It seems to me we may be sort of creating a moment where we're going to have piecemeal component parts of the government that stay open and piecemeal parts of the government that we decide don't stay open, so that this then can extend and go on, in perpetuity. And that seems like a terrible idea, too.
Well, I agree with you. I think shutdowns are terrible. And it's an indication, quite frankly, of the breakdown of the political process here. And you can cast blame on both sides, but this is the sixth time in 30 years we've had a shutdown. And recently, you've also seen debt ceiling crises where there's a threat not to default on our debt. So this is a serious indication of the breakdown of the process. But one of the existential fights here, beneath the surface, but really important to Americans, is the cost of health care. I mean, it has been rising way faster than inflation. It's a killer for small businesses that really have benefited by the Obamacare tax credits. They've been able to afford to continue to provide health care for the workers who they really value. So I'm with you on the overall critique of shutdown as a tactic. It really is not something that's desirable.
You can vote.
But there is a real issue about health care.
Yeah. So this guy is basically admitting that our tactic, okay, of shutting down the government, right, over healthcare is, not good, right? Not a good thing. Now, listen to this guy admit that Obamacare is not affordable. right? When you're talking about needing subsidies, more subsidies, right? I mean, Obamacare is already, again, subsidized healthcare. That's what it is, right? Essentially, that's what it is. But you need more? Why do we have to continue to subsidize something that was supposed to make healthcare affordable, right? What this man is talking about, how the cost of healthcare has risen much faster than inflation, sounds a lot like what? Sounds a lot like higher education. Why is it that the cost of higher education continues to go up every single year? Because the government is willing to fund it. That's why. Okay? That's why. Who's getting rich off of that? Who's getting rich off of it? The administrators, the employees at these colleges, the athletic programs, right? Everybody involved in big education, right? Big college, right? They're getting rich. They're making money off of it. At the expense of who? Well, people who have to go and get these student loans, and then leftists want the government to forgive the loans. AKA, they want taxpayers to pay for it, right? But again, the government is willing to give out unlimited amount of these loans in order to fund it. Grants, right, which are not loans. Again, this is just straight taxpayer money. All of this stuff bloats the cost of education. It's no different with healthcare, and I don't understand why people don't get that. Anything that the government says we're going to fund and we're going to continue to fund it with an unlimited amount of funds, the cost is going to go up. Doesn't matter what it is, okay? And that is the problem. And that's what people got to understand. Socialism benefits the rich. It benefits the elite. This is why you got all these millionaires running around talking about how they're socialist, because it benefits them. The free market benefits those who actually work, the people at the bottom. It gives you power. But when you get the government involved and they force these mandates on you, they force you to fund things that we shouldn't be funding, that takes away power from the people. That's what you got to understand. If people had an actual choice, which, again, hey, I'm not obligated to use my tax dollars to fund higher education or somebody else's education. I'm not obligated to do that. I want to go to the best school that is going to make sure I get a return on my investment because I'm using my money. I'm not borrowing money from the government. I'm not getting a grant. I'm using my money. Do you think these colleges will be able to just charge whatever? Do you think they better just increase costs every single year if everybody had to pay out of pocket, right? If the government wasn't socializing the cost of college? Do you think that colleges better just increase the cost? No, they would not be able to do it. Because people would say, no, I'm just not going to pay for it. Or people would say, hey, I'm only going to give my money to the college that's actually going to help me get a job, right? The best schools. That's the way that the system should work. But again, you got the government coming in and saying, we're going to solve this problem to make college more affordable. College didn't get more affordable because the intent was never about making college more affordable. It was about getting the elites, the liberal elites, paid, right? The lobbyists that lobbied for the policies. It was about getting them rich. And again, that's what really pisses me off about a lot of this stuff.
You're always reasonable when you come on, and I've said I've said that, and you're almost conceding that you should not be shutting down the government, that the Democrats should not be doing that, and I don't think you'd ever say that extortion is the way that Republicans should get their way if they don't like the IRA or they don't like overspending or whatever it is at any given point in time where the other party has a disagreement. This is not the way to do it. As far as Obamacare, you probably realize a lot of these premium increases are just built into Obamacare. The expiration of the pandemic subsidies is only a very small part of the increases. So that discussion has to be had about fixes to Obamacare so it doesn't keep spiraling, the costs don't keep spiraling. But you're not going to do that before we reopen the government.
AKA, it doesn't matter if the Obamacare credits are extended or not. Doesn't matter. Premiums are still going to go up. Why? Because, again, the government is funding people getting health care who don't contribute to the system. Okay? They're distorting the market in favor of big doctors, big pharma, big insurance, big hospitals. Everybody involved. The government is in on the scam of distorting the market, artificially limiting supply and competition in their favor, while again forcing taxpayers to subsidize a system for people who don't contribute. Okay?
It's not going to happen. It's going to have to happen afterwards. Are you ready to vote with the Republicans to reopen the government at this point as a reasonable Democrat? Maybe others would follow you.
You know, I'm not there yet because we have had literally, Joe, no discussion whatsoever about how we're going to deal with these spikes in premiums. This is the right way to do it, Senator? By people not getting paychecks at the TSA? This is extortion. You think this is the right way to do it? In your conscience, you think it's the right way to do it? I never thought I'd say that, Andrew, that as a human being, he always says that. As a human being, you think this is the right thing to do? That's your line. Well, that's why Senator Hawley and have our bill to make sure that folks get the nutrition that they absolutely need is why the president is paying the troops. But there is something that we've all got to acknowledge here, okay? The administration has had an attack on health care, as we know it. The Medicaid cuts were immense. They're going to have real impacts on individuals, and they're going to have impacts on state budgets and community hospitals. The loss of the premium tax credits is going to mean that folks are going to drop health care. I mentioned in Vermont, it goes from like $900 for some folks a month to $3,200 a month. That's totally
Senator,
unsustainable.
from $900 to $3,200 a month is not because of the tax subsidies alone. The Journal points out that the tax subsidies, these extended tax cut subsidies, are only responsible for about the expiration of those are only responsible for about 3% of the increase. That's peanuts. You still have a huge problem. You still have a lot of people who aren't going to be able to afford health care.
Well, first of all, I want to acknowledge you're right about that. I think it's much more than 3%, but the cost of health care. And if we're sitting down and talking, there's a number of Republican ideas about how to bring down the cost of health care other than by throwing people off of health care insurance. And if both sides were willing to face this, there'd be some acknowledgement that we've got to do something about PBMs. We've got to do something about prescription drug pricing power. We've got to do something about excessive utilization. So the real conversation should be about how do you make healthcare accessible by making it more affordable. Yes. And the approach that we've been taking so far is to throw people off of Medicaid and now throw people off of Obamacare.
Would you agree with
you're
the idea
hearing my
that
frustration.
I hear you, and I hear your frustration on this. Would you agree with some of the Republicans we've had on our air who say part of this is that you can't have zero payment premiums, where people are enrolled in these and have zero up cost? Even if you give them a $10 or a $15 copay, would you be in favor of that to make sure that it's a reduction of fraud, that you're not putting people onto these rolls who don't even realize that they're on these health care programs?
The evidence is conflicting on it, but I would absolutely be open to looking at any reasonable proposals that can make health care affordable by not having as the way to do it throwing people off of health care. That's the real issue here. And the point you just made, that's a reasonable point for discussion, but if we're not even allowed to sit down, and that's all really within the control of President Trump, I've talked to many of my Republican colleagues, hey, how do we work this out? Because the folks who are going to get hit and hurt are a lot of folks who voted for President Trump. It's not just like a Democratic deal here. Well, so they're open to having these discussions, but the president won't give
It's so funny how they keep using Trump voters. Well, Trump voters are going to get hurt. Well, yeah, you forced this socialized medicine on people who didn't want it in the first place. We didn't want this. Conservatives didn't want Obamacare. Conservatives were warning about Obamacare being a disaster when it was being debated, right? Before it was passed. Conservatives did not want it. Now they force you on the government system, and now they want to say, well, see, you're going to hurt conservatives. You're going to hurt Trump voters, okay, if you get rid of it. And it's like, well, yeah, you forced us on it, right? You forced people on it that didn't want it in the first place.
Permission to do that.
A lot of people are saying, where is Trump? I mean, he is over in China trying to do a trade deal that he thinks is going to benefit Americans. While this is happening back here, it really doesn't have anything to do with him. There's a clean CR sitting on the desk of of Chuck Schumer in the Senate.
Well,
right. Okay. If it was,
sure.
If you could get a 1-year extension, is that all you really want? Do you want a 10-year extension for $345 billion? What's the $1.5 trillion, Senator? What the heck is that? And why do you want that?
No, your point is, I'm not asking for $1.5 trillion, but you make a good point about a year extension because, as you know, these premium increases notices are going out now. And it is going to be drop dead for folks making decisions in November and
December.
December.
So that's what you want.
And there's no time. No, at a minimum, we've got to get it extended because there's no time for states who have to administer this to be able to make the adjustments that are required. And that's where the president could make a phone call. I get it.
He could say, we'll do it.
He's busy doing other stuff. He can, and that's what my Republican colleagues say. Hey, I'll talk to you, but we got to get permission from the president. That's the bottom line. It shouldn't be that way, by the way. We're all independent actors here in the United States Senate. We should be able to do things without permission.
The precedent, Senator, is that, the Democrats had this thing, it was only 3 or 4 years after the pandemic. It was going to lapse. You knew that. So you think it's because you want $40 billion now to extend it, you think you say, we want this, we're not going to. That's not the right way to do it. We want this or we're not going to reopen the government. You have to do this because we screwed up 3 or 4 years ago when we passed it in the first place.
Facts.
Well, let me challenge that, okay? Because those premium supports did expire. But in COVID, we had utilization going way up and we had employment going way down. But since COVID, the price of health care has continued to escalate and wages have not kept up. So there's practical challenges here that families and small businesses face that we want to address. Okay. So I get it about a shutdown, okay? But let's talk.
Yeah, because, again, the government continues to fund it. That's why, right? And when people realize that, people will understand that the problem is Obamacare. It needs to be repealed. And it honestly doesn't need to be replaced. What it needs to be replaced with is more competition in the free market, right? You need to deregulate all of these crazy rules, these regulations that, again, are not about quality. It's not about quality. It's about limiting supply and competition to keep prices artificially elevated so that big pharma, big doctors, big hospital, okay, big insurance, they continue to get paid, okay, and illegals can get health care, and all these people who don't want to work can get health care at the expense of people who actually work. When you understand how much of a scam socialized medicine is, once you see it, you can't unsee it. So let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.